Hello everyone, I'm here to do a little video. I forgot to put my headphones on, so I'm just going to do that now while everyone arrives. Sorry. Put my headphones on so I don't get distracted from little children. I've got something gold in my hair, don't I? So hello, I am, sorry while I fix my hair, I am Jem Nealon, and I am a midwife, a hypnobirthing birth preparation teacher and a trauma therapist. And I do one-to-one therapy in Edinburgh and now around the world. I have people in Europe at the moment via Zoom, and I also do teach hypnobirthing workshops. And I've come on here to speak to you about membrane sweeps because I have noticed quite a few posts on it, lots of different questions. So I thought I'd start a wee post, a video, give you a bit of an idea what a membrane sweep is, approximately when it would happen, pros and cons with a bit of a link to the research, okay? So a membrane sweep is something that routinely would be offered to you in normal circumstances at 40 weeks normally and 41 weeks. Now that could of course differ depending on where you are in the world and what trust you're in, but on average that's normally when it happens. So a membrane sweep, sometimes known as a stretch and sweep, is really, it's a kind of a vaginal examination where the midwife will do pretty much try and massage your cervix. And the idea is that they're trying to get your body to produce prostaglandin, which is a hormone that makes your uterus your cervix dilate. And we know that a membrane sweep, I can't talk, this stimulation can do that, okay? Now, why would we be doing it? So we kind of need to look at the pros for that. One of the reasons that we would be doing that would be to help in a way as a form of induction of labour. So some people hear that and they go, oh, that sounds really scary. I'm going to try and formulate what I want to say to you. I don't think I'm doing that very well. So basically, at 40 weeks and 41 weeks, normally in community, or maybe you're having your appointment up at the hospital, you would be offered a sweep. And the idea would be to encourage yourself to go into labour. So as far as the research shows, and there's so much research, all the research I could possibly find on membrane sweeps is in this post. If you come across something that isn't, another piece of research that you've got, add it to the comments. Some research shows that, and I wrote it down exactly, because a lot of it contradicts itself. There is an increase in SVDs, spontaneous vaginal deliveries, but not all of the research shows that, but some research shows that. Most of it shows that it reduces your chance of induction, and it reduces the length of induction if you are induced, and reduces the risk of oxytocin use, i.e. giving you synthetic oxytocin hormones to make your uterus contract in labour. And also research shows that it reduces your length of pregnancy, okay? Not all of the research shows all of these things though. So some pieces of research show it and some say, oh no, it doesn't reduce your risk of length of pregnancy. But in general, when I go through most of the research, the majority of it seems to show these things. So shorten the length of your induction, shorten the length of your pregnancy, and decrease your need for induction in the first place. The cons for a membrane sweep, there is some research that shows it can slightly increase your chance of infection, although not all research showed that. Some research couldn't find that. That makes sense, isn't it? If you're going to introduce anything into your vagina, there's probably going to be a slight risk of infection. Some people can find it discomfort. That was another thing that research shows. Now, a word on that as a midwife who has performed numerous membrane sweeps. It probably depends on the person a little bit, and we're going to come back. I want to talk to you a little bit about that in a minute. So some people go, oh, was that it? Oh, I didn't really feel anything. And some people find it quite uncomfortable. Probably feel something along the lines of a membrane, of a smear, if any of you had a smear test before. Some research also shows that there can be a slight increase in bleeding. Now, I don't mean huge bleeds, but a little bit of kind of similar to kind of show like bleeding. So anyway, look at the research yourself. And the reason I put that there is because I read a lot of comments in different groups for people going, it increases your chance of infection, don't do it. But the research is a bit hazy on that, or definitely do it. So always inform yourself of the research, okay? There's another benefit to membrane sweeps, I think, that I found as a midwife that isn't mentioned in research, and that is it gives us information. So I've seen many women come into an appointment with me at 42 weeks, and they ask for membrane sweep. We go through, I let them know what membrane sweep, and they decide to do it. And maybe what we can do when I'm given a membrane sweep is you can get some information about if the cervix is dilating or not, and what's happening. And this can give us some indication of how how likely you are to go into labour. There's no magic crystal ball, but it can give us some indication. But what I find is some people, maybe nothing's happening and we can't even reach their cervix, it's not even dilating. So then when they come back the week after, and they're totally fed up and they're crying or effing and blinding because they've just had enough, and we do another one, then I could go, well, actually your cervix is a little bit dilated. And then they're like, oh, okay, so you're seeing progress. And so I think it can give insight. You need to be aware that some people could find it uncomfortable. A lot of people don't. One thing I do want to mention is if for some reason a vaginal examination is triggering for you, then you need to be aware of that, and that could be an absolute reason to not have that examination. But at the same time, if that's the case for you, it's worth letting your team know that, and potentially looking at doing some work on why that is, one-to-one with someone who can work on that trauma in case you need vaginal examinations in labour. So I know that I've worked with people who have had real issues around vaginal examinations, done one-to-one work with them, or they've come and hit a birthing workshop. And what I would say is if it felt right for you, you need to go for your instinct. Sometimes people use a membrane sweep as an opportunity to practice their relaxation techniques and make sure you do have good techniques for all of these circumstances. It's not just about membrane sweeps, it's not just about vaginal examinations. You're using techniques during labour and birth and anything that's uncomfortable to make sure that you can relax and feel calm. So I think it's really important you follow your instinct as well. The other thing that I can hear is a real anti, don't take it, it's an intervention, don't do it. Yes, it is an intervention, but I don't want you to be filled with fear that it's the worst possible thing ever. If we were in an ideal world, we wouldn't do these things. But if you decide to not have a membrane sweep, I think you need to be aware that I've seen a lot of people who've then regretted that, because potentially they've gotten a situation where they've then needed to be induced and they'd wished maybe they'd had a couple of membrane sweeps rather than go for induction. So some people would say that it could help if you, well, research shows as well, some research shows that it can help if you're going to be induced. So yes, I understand that there's plenty of time, but unfortunately some people will tell you when they get to the induction stage and they get really overdue, if you want to call it like that, sometimes they start feeling the pressure on the other side. So some people choose to do everything they can to go into spontaneous labour. What else did I want to say to you? Does anyone have any questions? Does that make sense? What a membrane sweep is. So it's like a vaginal examination. You're normally offered at 40 weeks and 41 weeks of pregnancy. And the reason that you'd be offered this is to help get things going. Often it can help to gather information. Research shows it reduces length of pregnancy, reduces length of induction, reduces your chance of induction, but there is some research that can say it can slightly increase your chance of infection. The other one that I hear a lot is that you can break your waters. Now, looking through the research, all the research that I can find, some research showed that wasn't the case. There was one that said it could maybe increase your chance of your membranes rupturing, i.e. the waters around your baby rupturing, which kind of makes sense to me actually, because if it increases your chance if it shortens your length of pregnancy, then things that happen for people when they're more likely to go into labour is their waters breaking. And one thing, I'm holding this phone, my hand's getting a bit shaky because I'm holding it. Let me move it a little bit. So one of the things, what was I about to say? That I hear a lot is people going, no, because the midwife can break your waters. Now, there is no research on that. The research is that in some of the research says you're more likely to have premature rupture of membranes, i.e. the waters going earlier. But what I would say as a midwife, it would be very hard to do that. In fact, I have never myself done it seen someone do it, heard of someone do it during a membrane sweep. Yeah, it would be so hard, and I know it's hard to understand probably unless you've done a membrane sweep, to break someone's waters with a gloved hand. So I would slightly ignore that myth. I'm totally going on now. What I want to just give you is all the research, the pros and cons, and go with your instinct. And again, if you hear something, I think what's really important is instinct, because you don't know, for some reason, I could be preparing for having a baby and then I could be like, oh, I definitely want membrane sweeps. But for some reason, I just have this really strong feeling, no, it's not right for me. Go with that. And at the same time, if you're like, no, I was totally anti that, but it's like, no, this feels right. You need to listen to that because that is the right thing to do. And when I'm telling you about all this, if you're watching and your whole body is just tensing up and you're going, I can't even go there. I've worked with people who contact me saying I can't do it. Now that can be for things like previous sexual abuse and previous traumatic. I worked with someone recently, amazing woman on this group, who had a very traumatic smear, and because of that, she came to do some work and now is not bothered about the thought of vaginal examination. So please do that work because you deserve that. I'm totally going on and on now. Has anyone got any questions? The other thing I was thinking about doing is potentially doing a little Zoom session for people. A little bit of, I think there's only so much I can teach you, but a little bit of birth chat. I was thinking about scheduling something one afternoon, just a little bit of kind of mindset. This is what you need to do to get ready for labour and birth. Let me know if that's of any use. As usual, let me know if you want any videos on anything. I'm sorry I've been so quiet on here recently. I've just been crazy busy with 2 children and work. I hope that helps. If you want any other questions or you want to say anything else or share any experience of membrane sweeps, because there will be a full spectrum, please do. And if you know of any other articles or research on membrane sweeps, please share them as well so that we can have a full spread of info. Okay, I'm going to wave at Joanne and Emma and Melanie and the other 4 people who are watching, who I don't know who you are. Okay, any comments, let me know. See you later. Bye.